Health Department says over 30 million COVID-19 vaccine doses have been administered in South Africa. It comes as Cabinet approved new regulations reducing isolation for those infected from 10 to 7 days. Those who test positive without symptoms don't have to isolate. We're joined by the Deputy Health Minister, Dr. Sibongiseni Dhlomo, tonight for more on this. Dr. Dhlomo, 30 million people, it's considered a significant milestone, but when we look at how long it has taken us to get there, will we ever reach the kind of vaccination rates that were anticipated at the rollout of vaccines?
No, thank you very much, Kathy, and thanks for the acknowledgement of the 30 million doses that have been used in our country. You would recall, Kathy, that just last week, the cabinet of President Ramaphosa, while relaxing some of these regulations that you have made mention of, had this statement to say that a proportion of people with immunity to COVID-19 in our country due to either previous infections or vaccinations has risen right up to 80% from the serological studies that have been done. Now, that is saying, Kathy, there is a good story to tell if you are vaccinated. Yes, we would wish we had have done more. We want to congratulate those provinces, Free State being number 1, Limpopo number 2, and Western Cape, that are sitting way above 50% of their populations being vaccinated. And now we want to encourage many more to come on board. So we think it has worked. But, Katie, there's already evidence. You know, when you look into February 2021, when we just started with the vaccinations in the country, we started with our healthcare workers. When we were hit by the third wave in June, July, a significant number of our healthcare workers, those who had already been vaccinated, were spared from the death and serious infections. Kathy, you'd understand, again, we've just come out of the fourth wave. Yes, we have still lost a lot of our South Africans, many more admitted. But again, this fourth wave, its impact cannot be compared to the first, second, and third wave. So there is, again, evidence that if you are vaccinated, you really do make an addition, a very good immunity and a story to tell. So this 30 million has already gone to the arms of some South Africans. We want to advocate and plead with South Africans to continue coming forward and get vaccinated.
So, Dr. Dhlomo, just to ensure that I'm clear, it's 30 million vaccinations that have been administered, which accounts to how many people?
The population, look, I have to actually add up that in numbers, but it is almost, it's translating to 45% of the adult population of South Africa. I didn't come up with the ball figure. So that is what we have, 45% of the adult population, 18 and above. I could actually break down in terms of its own by age, but I can tell you that actually we are sitting close to 70% with those who are 60 years and above, and 55 and up to 59, about 62%. So the older ones have come in forward. So I didn't come up with a ball figure of this 45%, but that is a significant number in the country. Yes, you are right. We could have done better, and we wish we could do more. We noticed that just yesterday we had about 70,000 South Africans who came forward for vaccinations, and yet 2, 3, 4 months back we were sitting at around 150, 120. So we are still pleading with South Africans that, look, let us still use this opportunity because there's merit in vaccinations. Numbers are going down of the people who are vaccinated, per day, and we wish to improve on that. And this, again, is a call and a plea for them to come forward and get the jabs.
Dr. Dhlomo, let's talk about the fact that you yourself have alluded to it, that the South African population right now is largely considered to have some level of protection against COVID-19 because, as some of the scientists tell us, the majority of South Africans by now would have contracted various variants of the vaccines through the different waves that we've had. So when then it comes to the messaging that the department is embarking on to try and get more people to vaccinate, What are you saying to them?
Among other things, you'll recall, Kathy, we have our healthcare workers have now been fully vaccinated. We call upon them to come now and get boosters. So you see, we don't have all the answers, also guided by our scientists. How long will you have this immunity that you have in our body? Yes, there is this issue of the memory cells staying longer and immunity waning. But again, we are also comforted by that if you're vaccinated, it doesn't matter whether you got a fifth and a sixth wave, whatever variant you will have will still have some impact. It will be impacted by the vaccine that you have received, because the ancestral variants will still have some resemblance of whatever comes in the next few months and the other. So the urge to vaccinate and get boosters is because of that. Was everything is still new. Nobody can say, look, after 2 years, then you have no immunity, come then. So we are boosting, and we erred on the side of boosting our healthcare workers. We're the first group to receive vaccines. And but number two, currently we still have patients in hospitals. They are looked after by our healthcare workers. Rather, let's err on the side of boosting them, giving them more than what they have, so that they are ever extra protected. So that is the message that we continue to say. Yes, we have finished our vaccination, but at a particular time, we'll also call you upon to come and take your booster on the vaccine.
One of the main conversations around vaccinations has been around vaccine mandates. And we know that the health department, of course, has been encouraging South Africans to get vaccinated, and very much was behind the call to have everybody be vaccinated. But when it comes to your submissions right now on whether or not there should be vaccine mandates across the board for South Africans, where is that debate currently in the department?
Oh, no, Kathy, the issue of a vaccine and a vaccine mandate, it's something that is bigger than just a department. You would recall that the president made an announcement that this matter is actually a task of the interministerial committee chaired by the deputy president. We just make our own input and the contribution as health. So the interministerial committee led by the deputy president is the one receiving various submissions through consultation with the society as to what are the views of South Africans in terms of this matter. And we will have to await that process under the leadership of the deputy president to unfold. And I'm aware that the deputy president is receiving various contributions and submissions, and is considering that, and he will table it at the right time as to what are the views of South Africans in this regard.
That's fair enough, but are you able to tell us what the view of the health department is right now when it comes to vaccine mandates?
Kathy, pushing your luck. We will not have a view as health. We will have a view on vaccine mandate as a government. In fact, if we have got some views coming in from the Ministerial Advisory Committee, the minister will also take those views and table them into that committee. But I might as well add this, Kathy. I would want to argue that if I choose not to vaccinate, I must also respect the right of those who choose to vaccinate. And if they choose not to associate with me if I'm not vaccinated, that freedom of choice must also be granted. So that's a consultation that I'm actually aware is going on to say, if you are a leader of this church and you want to get all your 3,000 members to continue to come into the church every Sunday, stay for 3 hours, would you be able to indicate to them that it's much better if they are vaccinated? We know that this is preparing us to say, can we open the economy of our country better? Can we do more than this? This is much more, that's why I'm saying it's just not health, it's all the advices, but also government is looking into opening up more and more of its economic activities. The government is saying we don't want to go back to that lockdown. We are having people who are vaccinated. We now know that vaccines help and they actually save life. So why don't we go towards that side and therefore say, and because the scientists are saying this to us, Kathy, probably we are getting to a period we call endemic period, meaning you're moving from away from a pandemic. And endemic situations where you believe, you begin to say, this disease is probably going to be with us. We need to continue to protect ourselves against it. It's no more life-threatening, but provided you do 1, 2, 3, 4. So that is a situation that we are going towards. But again, the non-pharmaceutical protocols, together with vaccinations, will be the answer to this. So we don't have a view as Department of Health. We are collectively under the leadership of the Deputy President in coming into the final decision on this matter.
Deputy Health Minister, Dr. Sibongiseni Dhlomo, thanks for your time tonight.